Hi, I'm Kerri Courtney, and on this episode of Job Hunter, we're going to examine the exciting and high-paying world of healthcare in Mississippi. When we think of medical careers, it's easy to think of emergency rooms and doctors with years of education under their belts. There are lots of high-paying medical careers that don't require a 4-year medical degree.
These jobs are for people just like you, and they're available right now.
So if you're in need of a little career resuscitation, stay with us to learn more. Stay with us. Stay with us. Clear. Special healthcare-related episode of Job Hunter, and to the Hinds Community College School of Nursing and Allied Health in Jackson, where nursing is just one of the healthcare careers you can get training for.
Community colleges all over the state offer a wide variety of programs that can put you to work in just a year or two.
First up, we're going to take an inside look at Radiologic Technology, where people like you learn to produce images like these to help physicians diagnose all manner of medical conditions.
People think that it's just bones, broken bones. That's what you're taking x-rays of, and it's far more in depth than that. There's so much more that we do that people don't even realize.
X-ray patients in the ER. We go to the OR, X-ray patients during surgery.
We did certain exams dealing with abdomens and small intestines and large intestines and stuff like that.
Orthopedic cases, general surgery cases.
CT, specials, ultrasound, MRI, nuclear medicine, and memo.
We're going to talk to Steve Compton. He's chair of the Radiologic Technology department here at Hinds. Hi, Steve, how are you?
I'm doing great.
So what exactly is Radiologic Technology?
Radiologic Technology is a field that encompasses X-ray physics in the human body, and to where the physicians can diagnose what is going on with that patient. They can work in the emergency room or in doctor's clinics or just in basic X-ray technology areas at hospitals. They're allowed to specialize in different fields such as computed tomography or magnetic resonance imaging, ultrasound, nuclear medicine, or radiation therapy.
Tell us about your program here at Hinds. What kind of classes do your students take?
Our program consists of 2 years of associate degree classes, which involve X-ray technology courses, which involves human anatomy, algebra, medical terminology. Very intensive study. Then they have what is called clinical experience, where the students are actually in the hospital doing work, but they're learning. If they decide on taking an additional certification for ultrasound and nuclear medicine and radiation therapy, those each are 1 year. If a student wanted to go into computed tomography or magnetic resonance imaging, some of those classes may only last 3 months or 6 months.
This is Elizabeth Radcliffe. She's a student in the Radiologic Technology department here at Hinds. What kind of classes are you taking right now?
We're in physics, procedures, imaging, and then also clinical is counted as a class. I hope to specialize in diagnostic sonography. You can do, it's sonography and ultrasound. A lot of people just think ultrasound, they think babies, that's all it is. Well, it's not. You can do cardiovascular ultrasound, abdominal ultrasound. What I want to do is cardiovascular ultrasound.
Why do you think this is such a good field to go into?
You're really hands-on. You know, some fields you do, you don't deal with a lot of people. I like to deal with people. I consider myself a people person. I like talking to people, hearing their stories. And this, you're with, you're hands-on patients all day, no matter what field you go to. If you go into CT or MRI or ultrasound, you're still going to be dealing hands-on with the patient.
I can tell that you really enjoy what you do and you're enjoying what you're learning. What's the most fun part for you?
I think going to clinical and taking x-rays of different things, I really like the ER because you never know what's going to walk through the door.
Welcome to the real world, namely the ER at Mississippi Baptist Medical Center in Jackson, where people just like you conduct x-rays, MRIs, and CAT scans, all for a healthy paycheck. Let's talk to a few of them.
So it's unexpected. You never know what's going to come in. Your day's not planned before you come in here. Like, down here there's no script, and it's just whatever comes through the door is what you're going to be doing that day. Fast pace, trauma situations, I like that. I like that part about the field. Some people like working in clinic settings, where it's walk-in patients, and that's right up some people's alley. Some people would rather be in the hospital where it's more fast-paced, but you have those options in X-ray.
We have the ER, which is by far my favorite just because it's a faster pace and the different patients that you get, the different exams you get. And then we have what's called fluoro, which is just a live X-ray. It's more of kind of internal. You're watching them inject some sort of contrast and you're watching it go through their body and how it reacts with different parts of their body. And then we have the OR, where we go to surgery just to watch whatever we need to watch while the surgeon's doing whatever surgery that he might need.
I'll be in the ER for 1 week. I work 7 days on, 7 days off. So I'll be in the emergency room 1 week. Next week I will be upstairs in what's called the routine area, X-ray and inpatient. Then I'll be in surgery rotation, where we run the machine called a C-arm that's real-time X-ray during surgeries. So it's good because you don't get burnt out in one place.
Well, whenever you're sick, we're here to take care of you and figure out what's going on whenever they've been hurting for 3 weeks and they don't understand. It's nice to give them the answer to why.
It's very important. Without a chest X-ray on a patient that comes in short of breath, we have no idea if they have pneumonia, a collapsed lung. It's a vital part of taking care of patients, no doubt.
I love helping the patients. Some of these patients you'll see every day and you'll see them get better, and knowing that you help them, it makes it so worth it to me.
Well, I thought that was pretty revealing. And don't forget, they're scanning the entire state looking for people like you right now. And the jobs don't stop there. Opportunities in Mississippi's medical sector are reaching epidemic proportions. Just take the high-tech jobs available in one of the most lucrative careers to hit the medical industry in years, HIT, also known as Health Information Technology.
In a nutshell, health information technology is the application of information processing involving both computer hardware and software that deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge for communication and decision-making.
In other words, it's how we keep track of the patient, what's wrong with them, and how they're diagnosed and treated, all through the computerized management of information. And guess what? There's a huge demand for health information technologists, and you could be one of them. This is Tanya Mitchell, HIT instructor here at Hinds. Tanya, how are you?
I'm doing good, thank you.
I'm so glad that you're meeting with us today. Tell us, why is HIT in such demand right now?
There's a very high demand in our field right now because there's a lot of change going on. Previously, everything was done with a paper medical record. There was a lot of filing and paperwork and everything's being converted to an electronic format. They'll be called the electronic health record. A lot of hospitals are already going electronic, and that opens up a lot more areas. Actually, we expect a very high increase, 21% in the next 10 years, which is well above normal.
Tell me exactly what a health information technologist is.
Well, you can work in a variety of different settings and you manage health information. You take care of quality assurance or quality management by using the information contained within the record. There are 125 different job titles and 40 different work settings.
Wow.
I know. It's a lot of diversity and a lot of flexibility within our job field. Examples would be coding, quality assurance, physician documentation specialist, registries such as cancer registries, tumor and trauma registries. There's just a lot of diversity. Our students go to work in hospitals, law offices, clinics, nursing homes, long-term acute care facilities. There's a lot of diversity.
We're here with Ashley Bullock. She's a graduate of the HIT program here at Hinds. Tell us exactly what it is that you do.
I'm a compliance analyst for the physician's charges. I make sure that their documentation matches up with what they bill.
And how did you get that job?
With my degree at Hinds, I was able to qualify along with the experience that I had in the past.
Is this what you always knew you wanted to do?
No, I was able to, through UMC, get a position temporarily as a billing specialist, and it introduced me to the HIM field. And after I got into it, I kind of started liking it, so I applied for the program here, and I was able to get in. Within 2 years, I was able to qualify for a great career.
Now let's check in with a few HIT professionals.
I worked on a job for almost 20 years, and it was moved to China. And that made me be a dislocated worker. And of course that allowed me to qualify for a program through the WIN Job Center, to where they would pay for 2 years of an education. And I came across the Health Information Technology program. I was impressed by the fact that it was an accredited program, and I knew that whatever you got an accreditation in, you would become a hot commodity. So I am now a registered health information technician. My role here is a cancer registrar. What I do is gather information from pathology reports, and we enter information into the registry, and it is used for research to better care for the patients as far as medication, cancer prevention, and things of that nature. My first love is nursing, but I have the heart for it, I just don't have the stomach for it. And the next best thing was, as far as patient care, was to make sure that their records were protected. And that's the whole concept of health information technology.
It's all about trying to take better care of the patient. You know, it's a continuum of care. If you go from one facility to another facility, you really need to be able to access those records in a timely fashion so that you can, give the best care that you can to the patient. Our department is made up of 16 coders that work from home, and so they do remote coding. All their work is done online. Coding is a process in which you do turn a diagnosis into a code, and that code is a numeric code. It describes the condition of the patient. They're for billing, and it's used for a lot of data analysis.
My job is to capture what I can while the patient is in the hospital. I'm able to work with the doctors, I'm able to work with the nursing staff to get a better understanding and a clearer picture of what's going on with the patient. Because what I'm looking for is any abnormalities, any treatments, and making sure that it's captured and documented as specific as possible. You start from the beginning and you follow them, and it's like writing a little story. I like it, it's cool.
We're headed towards a total electronic record. The electronic health record is mandated by the federal government, and a part of that is also about health information exchange. We generally look for educational background where a person has graduated from an accredited school of health information technology. They need to have pathophysiology, pharmacology, medical terminology, and they also teach coding in these classes as well. Those are just some of the courses that we look for. We've always had a somewhat of a deficit in the HIT area. We really do need people to, enroll in school and go to the program. And the program, I understand now, is so much more flexible than it was when I was in school. You can go at night, you have some courses online, so it's easy and readily available. There's a definite need for HIT students.
In this field, it's wide open, and I can't stress that enough. And it is very rewarding. It's not something that you have to have a 4-year degree in. It pays a very good salary. It's not something that, you're starting off at minimum wage. It's a good salary. You can definitely make a good living, and the benefits are great. And I feel like, my job really matters. It is meaningful work, and it is helping make someone else's life a lot better.
Information overload. If you're looking for a career in healthcare, HIT might be just the prescription you need for a new career. But the opportunities don't stop there. And since we're here at Hinds Community College School of Nursing, we'd be remiss if we didn't take a look at, well, nursing. If you took the pulse of the healthcare industry in Mississippi, you'd find the demand for nurses is pretty high, especially in the Delta. And it only takes a year of training to start working as an LPN. Or is it an RN? I can never remember the difference. Can somebody give me a hand? We're here with Marietta Bradley. She's one of the faculty members here at Hinds Community College School of Nursing. So today we've heard lots of initials, LPN, RN, MPH, FBI, all kinds of crazy initials. So tell me, what is exactly the difference between an LPN and an RN?
Okay, the LPN, the licensed practical nurse, is trained to do certain duties at the bedside, whereas the registered nurse, or the RN, is trained to do even more. And we teach them critical thinking skills, so it's more than just taking a blood pressure, but looking at the blood pressure and knowing, is that good, is it bad, and what do I need to do about it?
How are the length of training times different for LPN versus RN?
In our associate degree program, the RN has 4 semesters. In the LPN program, it's a 12-month program.
So where would they work exactly? LPNs and RNs, are the places different, or can they work at the same place?
Generally speaking, they can work at the same place, but we are seeing more hospitals in the Jackson area hiring only registered nurses. And so the LPNs we're seeing move more into the community settings, such as nursing homes, clinics, things like that.
Well, with the LPNs, their day is basically, they major basically in looking at basic skills. They perform and administer medication. One of the latest things they can do is provide IV therapy, but there are some limitations to what they can do regarding IVs. With them having the different certifications, they can also do hemodialysis now, which about 5 years ago they were not able to do. So that is a major change. They can also go into different industries as well as the school and become school nurses.
We're going to talk to an LPN, Danae Brown. So Danae, tell us what you do day to day.
I'm an LPN. I'm the clinical liaison for a long-term care facility. What we do is we offer skilled nursing for elderly patients. We do have long-term care. It's considered a nursing home. A lot of people are familiar with that term. I actually go out into the hospitals and we get our referrals. As they get referrals, they'll send me out there to look at the patient. I'll check the patient out and make sure that clinically we are able to take care of them as a facility.
So Danae, your first job was working at MEA in a clinic as an LPN. What exactly did you do there?
Well, my job, I wore a lot of hats there, actually. As an LPN there, I worked as the lab and safety officer, where I took care and made sure the lab functioned under OSHA and CLIA regulations. I triaged patients, getting them into the clinic, and whatever doctor's orders we had, I filled those doctor's orders that ranged from giving shots, x-rays, going into the procedure room with the doctor, helping the doctors with the procedures. It's just a lot of stuff.
What's your favorite part about your job?
The people, the families I get a chance to meet. When I get a chance to go out there and talk to them, it means a lot to me to be able to say, hey, this is what you're going to go through, this is what you're going to expect. So that way they don't have to wonder, and on top of all the worries that they have already, because nursing covers everything. It's a holistic thing. You're helping them medically, but you're also looking at their well-being and making sure that mentally they're well, and it's just it kind of covers all of those areas that I was looking into, because you kind of become a teacher and a counselor and everything along with medically.
Now let's turn our attention to RNs, who need just a little more education to fulfill their responsibilities.
When you think of patient lives, you think of, I thought it's the doctor, I guess, of having all the responsibility, but nurses carry a great responsibility for their patients because you're with them all day, all the time.
Terry Diffie is a nursing manager at Mississippi Baptist Medical Center.
An RN, in their duties and their roles, they would collaborate in the care of the patient. They would do the plan of care for the patient in collaboration with the physician. On a daily basis, they are responsible for assessing their patients. They're also a teacher to that patient. They need to instruct the patient as to what's going on in their routine for the day and tell them what's going to happen. You know, communication is a big part of being a nurse. Also, they do dressing changes. They do any kind of surgical procedures when they come back. They do assessments on taking care of families is also a big part of being an RN. You have to be multi-talented, you know, to deal with the family as well as the patient. But observation, communication, and organization is probably the biggest skills that an RN would really need.
On a daily basis, we go check our charts, get blood pressure, temperatures, all the other vital signs, and then we also do we'll take off dressings and change dressings. We change the IVs when they have to be changed a certain number of days, so we start a lot of IVs up here. I just like taking care of people. Like, I just really enjoy getting what they need, and then a lot of times, some of them, they don't have family that come and visit them, so you're their nurse, their family, like you're their advocate, that you have to get what they need, and I really like that.
I'm going to take a quick listen to you.
I think when I go to hire a nurse, one thing I look for is a great personality and somebody that's willing. You can see that they want to learn and want to grow as a nurse. Of course, the minimum basic degree of 2 years, an associate degree is fine. We do like 4-year degree nurses also, but you know, any degree is fine. I also like somebody that wants to be a team player and be on a team, and that would demonstrate teamwork, dependability, willingness to learn, a good attitude. Those are some of the basic things that I look for.
With the changes in the healthcare system, there is such a need for people who do know what's wrong with the patient, what to do about it. A big piece with registered nurses also is education of the client, how to stay healthy, how to stay well, but also how to live and have quality of life even with a chronic disease.
Are there certain parts of the state that have a greater need for nurses than others?
Probably more the rural sections of Mississippi. I know the Delta is an area that for years has had a great need for registered nurses.
I chose RN because I know it was more like hands-on care with the patient, and it was more thorough and detailed. Getting to know them on an individual basis, finding out, you know, their needs, their concerns, and becoming attached to them as family. and leave. And sometimes it's tough, especially when I done got attached to them and they've gotten attached to me, making sure they're getting taken care of in the community as well as they have at the hospital.
I think as a nurse, if you don't get into the emotional aspect of it, you probably don't need to be in the nursing profession. You know, you have to want to take care of people. And I think that's one of the major things. If you enjoy taking care of people, you are really geared into learning and want to do something that's going to make a difference. Nursing really makes a difference in a lot of people's lives.
Well, that about wraps it up for our look at healthcare careers in Mississippi.
We've discovered a wide variety of careers that don't require a PhD, from radiologic and health information technology to a few different types of nursing careers. And one thing's for sure, they're viable options for anyone looking to nurture a new and rewarding career in Mississippi's thriving healthcare industry.
And look, my ride's here. There are plenty of other jobs we couldn't cover in today's episode. So visit your local community college or Wynn Job Center to learn more. Well, that's it for me until the next episode of Job Hunter. Someone give me a hand. Sorry, that hit just hit her in the face. I'm so sorry.
Priscilla, what kind of, ask that question again.
I don't know how to keep it from dinking. Can I step on it?
Yes, you can.